What are the subtle symptom differences between flu strains? Imagine catching the flu and wondering if it's caused by the same virus as last year or a different one. While flu symptoms can feel very similar, there are some subtle clues that might hint at which strain is behind your illness. But remember, only laboratory testing can confirm the exact strain. Both influenza A and B viruses cause many overlapping symptoms. You might suddenly develop a high fever, chills, a cough, sore throat, runny or stuffy nose, muscle aches, headaches, and extreme tiredness. Sometimes you might even experience nausea or stomach pain, but these gastrointestinal symptoms are less common. These signs are usually more intense than a cold and can lead to serious complications, especially if you have underlying health issues. Now, looking closer at the differences, influenza tends to cause more severe symptoms overall, especially in adults. People often report feeling worse with influenza A, with higher fever and more intense body aches. Influenza B, however, can be just as serious but is sometimes associated with more complications in children under 5 and older adults. Some studies suggest that influenza B might lead to a higher risk of certain complications in children, but overall, both strains can cause significant illness. When it comes to how quickly symptoms appear and how long they last, both types usually cause symptoms that stick around for about a week. Fatigue and cough can linger even after other symptoms fade. There's no consistent evidence that one strain causes symptoms to start faster or last longer than the other. Some reports suggest that muscle pain might be slightly less common with influenza A compared to B, but this difference is very subtle and not reliable enough to help with diagnosis. It's important to note that these differences are small and not enough to tell the strains apart without testing. On a biological level, influenza viruses can infect humans and animals like birds and pigs. This ability allows them to mix and create new strains, sometimes leading to pandemics. Influenza B viruses only infect humans and do not cause pandemics. Influenza mutates more rapidly, which is why we need new vaccines each year. Influenza B changes more slowly, making it somewhat easier to predict and include in vaccines. In terms of when each strain circulates, influenza tends to be more common early in the flu season, while influenza B can cause late-season surges. But these patterns can vary from year to year. Since symptoms are so similar, doctors relying on laboratory tests to identify which strain is causing illness. Rapid tests are often used in clinics and can give quick results. Knowing the specific strain can help track outbreaks and guide treatment decisions, especially for those at higher risk of complications. Most people recover from the flu with rest, fluids, and over-the-counter remedies. Antiviral medications are available and effective against both strains if taken early, especially for those with underlying health conditions or at high risk. To sum up, the symptoms of influenza A and B are very alike, and you cannot tell them apart just by how you feel. Influenza tends to be more severe in adults, while influenza B can be more problematic for young children. Both are highly contagious and can cause serious illness. Getting vaccinated each year is the best way to protect yourself from both strains. If you experience severe symptoms like difficulty breathing, chest pain, confusion, or a persistent high fever, seek medical attention promptly. Always consult a healthcare professional for diagnosis and personalized advice. This information reflects current scientific understanding and guidelines from major health authorities, emphasizing the importance of accurate diagnosis and treatment.